just wear and tear, etc. And I'm wondering if your rehab protocol changes when it is something like arthritis that is diagnosed for one of your athletes.
I think it depends on the person, of course, because some people are going to have more of a predisposition for that, and making sure they don't have like more of the natural kind of inflammatory factor, which would be like the rheumatoid versions of that, which can be, managed with medications and other ways. But from like a mechanical standpoint, there's not a lot of red flags per se for loading an arthritic joint. And in most cases, the science would say that strength training and loading at a high intensity, low volume over long periods of time with slow increases should help like the cartilage as much as anything. So again, it's another one of those, exercise is the best thing we have to a miracle cure. Not a miracle cure, but it's like probably not risky necessarily. Like, and this is really common in like climbers' fingers. Like climbers have ugly hands. All their nuts are all janky looking because they load. Now the amount of like, I always think about, every time I talk to someone that's been climbing a long time and they have like a finger injury, I'm like, and they're like stressed out about it, I'm like, think about how much stress you put on your fingers over 20 years and you've had one finger injury. I was like, that's that they can tolerate so much. All joints. But all matter has limitations. At some point they get some sort of repetitive positional thing that creates irritation to the joint, and the joint gets swollen and the bones get hypertrophied, the ligaments get hypertrophied, the knuckle actually gets arthritis, and other joints get arthritis as a response to make them more stable. So like in the spine, if you took 1,000 people through an MRI scanner, most of that are like above 60, almost all of them would have arthritic changes to their facet joints in their back. And that really is just like your body responding to mechanical stress to make it more protective. So I think on the whole, like managing the pain, I think managing the pain is different than managing the pathology. The pain is people with pathology or findings on an MRI with no pain, they're not patients, right? People that have pain complaints, even without MRI findings or with MRI findings, they are maybe patients, but they need like, not like a bunch of like passive soft tissue things. They just need like a more well-rounded, structured program for their life, more than like a single thing.
Tyler, it was honestly mind-blowing for me as well, because I am one of those specimens with very misshapen fingers, a lot of synovitis on my fingers, and the hangboard protocol, which is hanging on your fingers, for certain lengths, for certain with certain repetitions over time, that really helped me get over my finger pain. So I think for that particular situation with finger range, absolutely, I've given that advice to many people, sometimes even unsolicited, because I would see somebody at the crag or at the gym, with like funky looking fingers. I'm like, hey man, if you're feeling pain, you need to get on that hangboard of yours a few times a week and teach your fingers how to gradually accept stress. Is that also true for other joints? Again, the knees, ankles, shoulders, elbows, etc., where perhaps the arthritis is, let's say, end stage. Let's say there isn't cartilage left and it's bone on bone. And in those cases, have you seen people do well with the weight training type of rehab protocol?
It depends. I definitely don't see as many of those, but I would predict that they definitely are not going to respond to the same volume of like strength training and stuff. Like I would still like promote slow, controlled strength training with modified ranges of motion per the individual, right? Based on what they actually care about doing, which is why for rock climbers, I'm always like, all right, cool. Let's find a way to keep you loading your fingers to make you feel and know that you're still a rock climber, because loading is okay. Because if I give a bunch of exercises to someone that does not care about the exercises, the research shows they don't really help people. Just that's the problem with like the rehab world is people selling the idea that this thing is good for this pathology. But if the person doesn't give a damn about that, it's not a very good choice for that person. So I think those people need to be like managed more tightly than most of my clients who are like pretty well kind of navigate it on their own, because they're not going to have the same capacity. But most of the orthopedic surgeons that I know, or people that work in like the prosthetics, like replacement space, would say you do not want to get those kinds of things unless you absolutely have to. So at some point, if you really are bone on bone in the knee, like getting a knee replacement isn't like an okay decision and a personal decision for people, because but some people will tough through it for a really long time. Like hips are the same way. Hips, most doctors will say, don't get a hip replacement until you can hardly walk and the quality of your life is really suffering. And so I think a lot of people get scared of pain and fearful of pain, and that kind of drives not doing things because of the fear of pain. But like, it's not until those end stages where it's really self-limiting that you need to be overly concerned about it. But most of the time, that's again the exception, not the rule. But again, I don't work with people over 60 that much. Certainly that's the population that are getting end stage arthritic changes.
Got it. Tyler, one thing I think myself and a lot of your other followers or patients or what have you love about you is you dog food your own training. And by that, what I mean is you're a talented and dedicated rock climber yourself, and you're always out there experimenting on different types of injury prevention, injury cures, and other kinds of training methods. One thing I believe